confused. It means the world. Ah! And my ticks have gotten better. And
they've gotten better when you're home.
Yeah, they've gotten better when I'm at home. But, like, now I more get them, like, ah! When I'm, like, nervous, like, stressed, happy, excited,
upset, tired,
mad, overly tired.
Talk about kind of how you've been handling your ticks.
Well, I think that I have a pretty good attitude about my ticks. And, so I've had a pretty good attitude about my ticks, and, like, I just, like, play them off as a joke, or, like, I used to be an improv, so sometimes I use a little of that, make up little situations with my ticks, and just play along with it, and make everybody laugh with them and stuff. And
why have you been doing that?
doing what?
Just, trying to make light of them and stuff.
I think it's easier just to laugh them off instead of, like, everybody, oh, I'm so sorry, and
just when people get upset, it makes it worse.
when people get upset about it, or, like, got it! Ta-da!
She says ta-da a lot.
Ta-da! 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 And, okay, where was that? Okay, making light of the ticks. I make light of the ticks because it just seems easier, and it's not as awkward. And, ta-da! It's not as awkward, and, like, when people feel bad for me, it makes me feel bad about myself, kind of, because I don't like people feeling sorry for me and stuff, and I don't feel sorry for myself. I don't pity myself or anything, and, like, I know it's going to get better, and if it doesn't get better, then I can just be proof that there are effects after Lyme disease. For those people that do not believe in chronic Lyme, and those people that believe 3 weeks of treatment is enough. And
because you had 3 weeks of treatment.
I had 3 weeks of treatment
in October of 2011.
And it did not work. And the scary thing is if I would have gone to a normal doctor with these ticks, I would have been diagnosed with most likely Tourette's.
Which makes us wonder how many people out there.
How many people that possibly do have Tourette's, or like possibly have Lyme disease, but they've been misdiagnosed with Tourette's. But I don't want to give like too many people false hope. But so I don't want to give too many people false hope. Okay, moving on.
Yeah.
Yeah, okay, moving on.
So what's changed since last week?
Okay, what's changed since last week? Well, the only bad thing so far that has happened is I blacked out and hit my head and hit a huge goose egg on the back of my head. But I mean, it could have been worse. But I haven't been able to attend school. And we're actually getting set up plan where I have a tutor come in like so many days a week, and I don't have to do all the assignments that aren't required.
You have to learn the core curriculum.
I have to do the core curriculum. And
how do you feel about school, not being able to go to school and finish out the rest of the year?
I really do want to go to school. Like, I think most kids would be like, yeah, don't have to go to school. I want to go to school. Well, like, I don't like school, but I do like school. And, like, the most thing I would miss is, like, being with my friends, even though they come and visit me all the time. But
you've told me that it scares you. You're gonna miss out on a lot of your high school years.
I'm worried that I'm gonna miss out on a lot. Like, I already am like missing out on just things that like
track.
I cannot do hurdles anymore, which I'm kind of upset about. Like, I did hurdles for practice the first 4 weeks, and then I could hardly walk upstairs.
Okay, then do you want me to talk about the blood work that we got back just yesterday?
Okay. What was my blood work again? I had 3 co-infections.
We have 3 co-infections.
It affected my adrenal glands.
Her adrenal glands, her cortisol levels pretty high. And your thyroid, your immune system is really down tremendously. And you have low functioning thyroid.
I have a low functioning thyroid, which, thank God, I thought I was just eating too much. But,
because that kind of does put weight on a little bit with high cortisol levels, we found out.
Yeah.
And she's not put on weight that maybe she didn't need.
I gained 20 pounds in 1 month, and I was running a mile every day after school.
Before this.
And now I can barely, like, walk around. Like, I could barely walk down our driveway without not being able to catch my breath. Sometimes I'm laying there and I can't catch my breath. Right now I can't catch my breath, but
your tics are becoming a little bit better now that you're a little more relaxed.
Yeah, my tics have gone down.
And your first video was actually recorded the day before you saw your Lyme literate doctor.
My first video, which if you haven't seen it, you need to go see it.
So you understand this one.
So you understand this one. That was the day before I got my
antibiotics.
My antibiotics and other stuff.
Supplements. But mainly 2 different antibiotics that you're on now. Yeah. And we found out that now because
I'm going to get the PICC line.
Because the vocal tics and physical tics happen so quickly and were so bad so quickly.
And
so we're getting PICC line next week and tomorrow.
And tomorrow I'm going to get an MRI. My very first MRI.
Which is going to be interesting with tics and having to lay still for 45 minutes. So they're going to try to give her some.
It's told me to take volume at 11, and then I will be like in the MRI machine thingy.
You take a volume an hour before and then about 15 minutes before. so that will help her to not be having so many ticks, because she does not have ticks badly in her sleep. Well, not really even full-blown ticks in her sleep. She has twitching in her sleep that can affect her whole body, but not, obviously not the verbal ticks. But she's had a lot of difficulty with sleeping.
And,
because it's hard to get to sleep when your body won't stop moving.
yeah, it's hard to get to sleep and your body won't stop moving, and then you're like trying to stop them moving, and then you hold it in for a minute, and then it just gets worse. Because
you can hold them back, but some.
I can hold them back some. I need my brace for my hand. Another thing is.
But it's uncomfortable and it hurts, right?
Yeah, it's uncomfortable and it hurts, and I feel really, really, really anxious.
When you try to hold them back.
When I try to hold them in. And then after I hold them in, what was I saying?
And I just want to say that, like, our school has done a super job of helping us in every way that they can and being supportive. And matter of fact, her principal brought paperwork out here to our house today. We live out in the country, about actually 25 minutes from our school. Brought paperwork out today for us to sign, so that, because I can't drive, so that we could get her assistance in school started right away. And also,
by the way, my mom is the one talking in the background.
Yeah, and also she's gotten a huge amount of support, and a lot of people that have reached out to her from her high school. Some people
and
that she
in
other high schools. Some people that she doesn't know well, but we hope that she maybe gets to know them better, since they've been such a big support and written such nice, caring things.
Yeah. And
so we've seen an improvement after, actually it was after about the 4th day of antibiotics, of the oral antibiotics. So we're hoping that the ticks will really decrease now once she gets the PICC line in next week, which we don't know for sure which day. But it did take, with this going on, related to Lyme disease, it took basically almost a week to get the insurance to approve an MRI with these type of symptoms going on, which I think is scary.
ridiculous, and they won't cover a contrast run.
They're only willing to cover 28 days of the PICC line for us.
And